Well, we're going to be talking more about the swine flu and how it's affecting San Diego County and what we can do really to take note and be careful and try to prevent this from spreading. So Dr. Elizabeth Salata is here, who specializes in internal medicine. And thank you so much for coming back. And you've got the sanitizer on the desk and the mask, and we're going to talk about kind of what that's going to help and make sure that people know.
Right.
And you've already got your kids going to school. You've been giving them instructions.
Well, I pulled them together yesterday, and I just reminded them of the basics: washing their hands, not sharing things at school like any food items, being careful at the water fountains. I actually sent them with their own bottles of water because I figured the less they touch that's community, the better.
Right. You're not worried about the water supply at school.
Not
You're just
all.
worried about them touching handles
just
and that type of thing.
things that are common things
Sure.
that people touch. So, and I sent them with the alcohol-based hand sanitizers, which we need to clarify because it kills viral things, not bacterial things.
So the bacterial-based sanitizers are
not
basically
bacterial.
They're ineffective against a virus, which is
no
antibacterial.
The hand sanitizers, the alcohol-based hand sanitizers, are effective against viruses.
Right. That's my point. If you see something that says antibacterial, you're not necessarily killing anything that has to do with the swine flu.
Correct.
Okay.
So that you're probably referring to like antibacterial soap and things like that. Right. That's a little different than the alcohol-based hand sanitizers, which are designed to kill viral things, and things like this, which are designed to kill viral things. So yes, the antibacterial products are designed to kill bacteria, but these sanitizing products that have alcohol-based, in them, in their ingredients, will kill viral things.
That's the distinction we've been trying to make this morning.
Exactly. Right. So there's antibacterial soap, and then there's antiviral products that contain alcohol that kill the virus. So you can wipe things down, you can wipe your hands,
Now, we were talking during the break, and you said that you've had many more patients come in kind of wondering if they might have this, and you've been taking more tests. How often are you being updated by the health agency?
Every couple of hours, at least twice a day. I have a little BlackBerry. I get notification on my BlackBerry. I get called to make sure that I've checked my messages that they've sent me on my email. They're doing a wonderful job of keeping providers
So this is where the technology
informed.
really works in our favor.
It's fabulous. It's fabulous. And they're notifying everybody throughout the world. We're getting worldwide updates. I personally am getting lots of updates all day long.
What is the difference then for people between the swine flu and regular flu?
The symptoms are very similar, and that's the trick. The difference with the swine flu is we're seeing a little more GI symptoms. The typical flu has sore throat, high fever, cough, body aches. Now with this, we're seeing a little more GI symptoms. The trick is 2 of these symptoms, they're telling us those should be checked and swabbed and things like that. So any 2 of the symptoms I mentioned are the ones that we're checking people for. So for example, yesterday in our clinic, we swabbed about 6 or 8 people that came in with symptoms that met the criteria that we then checked.
But now, in the United States, if 36,000 people a year die from flu-related symptoms, and so far nobody's died that we're aware of from symptoms related to the swine flu, why are we so worked up about this?
That's a really complicated question, but I'll do my best to answer it. One of the things is that the average age right now in San Diego is 16, so it's typically healthy people. And as you said, it's flu-related complications. So it's not always the virus that causes the death. It's typically the complications, like the bacterial pneumonias and things that you get, the super infections that you get on top of the viral infection. So everyone in the United States is recovered. That's the great news. Typically, that's not always the case because it's the extremes of age that are affected with typical influenza. So for example, the ones we got immunized against for this past season, we want to immunize the very old and the very young because those are the high-risk people that will die from complications of influenza. So the people that are getting this are the people that are the young and healthy ones that are circulating because we haven't been vaccinated. We don't know that you're infected, I'm infected. The incubation period's interesting because you can have it for 24 hours before you ever get symptoms, and then you can be passing it along for the next 7 days.
Now, for all these people that you swabbed yesterday, how long does it take for the results to come back and actually get confirmation?
And that's part of the lag period here because it can take 48 to 72 hours, and then they want to send it out and do more confirmation on exact typing. So that's the trick with what we're seeing and why there's this lag and why we see all these new cases, because there's a little lag period in detecting it.
I wanted just to mention for Joe from Cardiff, wrote me this morning and said, hey, I hear you can use a little bleach solution to disinfect around the house, wipe down handles and different surfaces and so forth. You use that around your own home.
I do. Typically, you can make it just a diluted solution at home with about a cup of bleach to about 5 gallons of water, and then just use that to sanitize surfaces, especially people home as caregivers for people with influenza. It is recommended that they be very careful in terms of passing it on to themselves if they're caregiving for somebody who's ill. So they want to sanitize, they want to wash their hands, they want to mask, that kind of thing.
Now, the mask, before we go, not all masks, you don't just go to the hardware store and get one of those, masks to keep sawdust out of your nose.
Well, I brought a few, and I don't really want to cause mass panic and for people to run out and buy these. I personally, this is an N95 mask, and I got this from the medical supply company that I work with. I wore it yesterday, and the reason I did is I didn't want to panic people, but I felt an obligation because I don't know who before that patient may be incubating something.
Right.
I felt
but N95, that's the key.
But these you have to get from a medical supply company.
All right.
Yeah.
Well, thank you so much for coming in.
Absolutely.
We'll probably see you again as this continues.
Call me as you need
All
to.
right. Thank you.
Thanks, Doctor.